to the November 5th, 2020 Board of Directors meeting. I will call the meeting to order. It is 5:32 p.m. First up today, we have a presentation from our team with regard to some of the fine work we're doing at the long-term care facilities around the Essex County community. So we will play that now.
We'll hand it off to Karen.
Or hand it off to Karen and then play it. Sorry, I apologize, everybody.
Oh, we gotta unmute you, Karen.
I'm just trying to find her.
Trying to unmute and I can't. Matthew, can you try to unmute Karen McCullough?
Yes, I have been.
She's going to say how great of a job we're doing. Sorry, bear with us. Maybe I can.
She's made co-host. Karen, can you try to unmute yourself? Are you trying? Yeah, you're trying. Struggling here. Well, do you want me to try, Anthony? I will be as eloquent as Karen. And if Karen, you get unmuted, jump in. Sorry, I don't know what's going on. But I am now Karen McCullough due to technical difficulties, but welcome everybody. Tonight we're going to have a presentation from two individuals. We have with us Marie Colarossi, who is our manager of utilization, and Eric Vitale. Erica is our director of infection control and pandemic planning, among other things. And what they're going to be presenting tonight is a presentation regarding what we've done as a region, as Erie St. Clair, with respect to our long-term care and retirement home sector. As everyone knows, they are a vulnerable sector that has been impacted by COVID on a very large scale negatively with respect to the impact COVID has had on long-term care and retirement homes across not only our province nationally, but internationally as well. And our hospital, along with a bunch of other agencies, got together earlier on when COVID hit to try to help support our long-term care and retirement home sector. And now it's been mandated by the province to do this work for hospitals to have a much closer relationship. At the same time, most recently, and why this is very relevant, is there's been a commission was put together by the province to examine long-term care and retirement homes and some of the issues they're facing historically, as well as that came to the surface because of COVID. And there were some interim recommendations that were provided that talked about this concept of working far more closely with long-term care and retirement homes for hospitals do that. So without further ado, I will put up the presentation, just bear with me. And then following the presentation, Erica and Marie are available for any questions that the board of directors might have of them. So 1 second.
Now, I'm just going to ask if people can, I think there's a lot of people freezing, and maybe it's my computer, but if you are having freezing issues, if your picture is starting to freeze, if you go to stop video for yourself, it may speed up everybody's overall internet process here. So if you don't need your video on, If you're talking, just turn it back on. But in the meantime, if it's not needed, please just stop your video for now.
So I'm going to start it now, Mr. Chair.
Yeah, thanks, David. Sorry.
No problem.
Today we're going to talk about a partnership that was developed amongst the Erie St. Clair Lynn members. These individuals or groups included members of our public health units, our local long-term care retirement home leadership, home and community care, emergency medical services, and all of our local hospitals, including Windsor Regional, Chatham-Kent Health Alliance, Hotel Dieu Grace, Erie Shores, and Blue Water Health. Early on in the pandemic, long-term care, rest, and retirement homes were hit hard with COVID-19 outbreaks that swept across the province. Many hospitals stepped forward voluntarily to support the long-term care and retirement homes. Some of these homes were already in outbreak by the time that we had come to visit them. There are 43 homes in Windsor-Essex, 19 in Chatham-Kent, and 19 in Sarnia-Lambton. Our visits to long-term care, rest, retirement homes began in mid-April and carried on throughout June. SWAT team that was formed and visited the homes consisted of some administrative leaves, infection prevention and control professionals, occupational health and safety representatives, and housekeeping and dietary expertise. I'd also like to mention the contributions of our Windsor-Essex EMS, as they were not necessarily part of our SWAT team that visited homes and did reviews of their practices. But they did go in and help us with some of the initial testing in some of the outbreaks homes. They were able to get in and take nasopharyngeal swabs on all the residents there. Initially, we did have to prioritize our site visits. So of course, we chose the homes that were in outbreak first. We did do a thorough review of all the infection prevention control practices and housekeeping within the home. So this would include like top to bottom tours, reviewing resident rooms and common areas. We did identify many areas for improvement and then always included a debrief at the end of the visit, followed by a report out. During these visits, we did identify many areas where our SWAT team could assist. So some examples would be testing of the residents and staff, acquiring personal protective equipment supplies, reviewing their housekeeping practices, and then reviewing infection prevention and control measures that were in place. So for example, the type of precautions used for residents when they develop symptoms, and then the processes for screening at the entry points, some good examples. The SWAT made some suggestions to changes in practice based on how COVID-19 is spread. Then we prepared a report that we provided to the homes, and that allowed them to have something in writing that could allow them to develop solid action plans. Based on our experiences in the homes, we did develop a rapid response to COVID outbreaks, so a type of procedure that we could follow and kind of keep standard when we did have homes that were in outbreak. So it provided us a good underlying knowledge and understanding of common issues that are faced by the homes. Some of the items that are in our rapid response team is early infection prevention and control support, development of an outbreak management team, expanded testing of residents and staff. So for example, it may be recommended that a roommate is tested if someone develops symptoms, but you may find out by talking with the staff that, oh, you know what, this individual that lives across the hall likes to frequently visit that individual. So you need to identify those individuals as well and make sure that they are tested. We also provided some staffing support, which the LIN assisted in placing some additional staff in the areas, homes that needed it. We also review proper cohorting of the residents within the home. So cohorting is referencing putting sick individuals with sick individuals, separating those that are sick from the non-sick or asymptomatic individuals. We also did assist with some of the staffing needs in the home. So for example, we may have brought in some additional PSWs to help sit with some of the patients or residents to keep them busy. So one of the things we noticed when we did use the rapid response is that we had a much better outcome than in other homes that we had visited where there was a delay in some of the assistance. So for example, we did visit one home that had approximately been a month in outbreak before we visited. That home ended up with about 50% of their residents that became ill with COVID-19, which would have been about 20 to 25 residents. 4 of those residents did die from COVID-19 related symptoms. So our last to assist with, we had very minimal spread due to our early response and early testing of everyone in the home. Home was relatively small, so we considered it one unit and treated it as such. So we did weekly testing to make sure we identified any individual that was possibly a carrier of COVID-19, whether they were ill at the time or not. We were able to isolate those individuals, and then through some visits, we were able to bring some of those individuals into hospital for assessment if they weren't doing well. And we had actually no deaths following that. So just getting in there early, we were able to contain it quicker, ensure that we were isolating the right individuals, the ones that were symptomatic and or testing positive. And then we were able to do health assessments and make sure that anyone that needed a higher level of care was brought into the hospital. So we had a much better outcome when we were able to get in there and rapidly identify these things and isolate the individuals.
Sustainability plan. Our 3 area hospitals came together to develop a standardized sustainability plan to prevent the spread of COVID. These plans were developed in conjunction with long-term care, retirement home, public health unit, and home and community care. To note, Chatham and Sarnia have also developed plans to prevent the spread of COVID. Further efforts are underway to regionally develop standardized plans. Daily metrics are reviewed for areas of concern. Sustainability plan. Developed to strengthen the processes and partnerships created. The focus is on prevention, early detection, and immediate intervention. There are monthly site visits, weekly touch base, tracking and trending, and daily review. Audit tools, such as the sustainability checklist, is used to identify flags for potential issues. Follow-up plans are then developed with the administrators of the home and form the basis or the focus of the next scheduled visit. Tracking tools. There is a daily review and drill down of the long-term care and retirement home ED visits and admissions to Windsor Regional Hospital. We look to see who is coming, from where, how often, what are their presenting diagnosis, are they presenting with COVID-like symptoms. The tool provides a rolling 7-day bird's eye view of 43 facilities, and a drill down flags early warning signs that we can in turn review with these facilities. As you can also see, the graph is showing a downward trend of ED visits and admission, which is something you want to see. I'd like to share a few testimonials with you right now. As you may recall, Country Village was one of the first homes to find themselves in a COVID outbreak. This was well before the partnerships were developed. The home found themselves with a team of help, from EMS assistance and swabbing to a SWAT team support to needed supplies. The additional relationships with the hospital provide excellent value-added support, states Janet of Country Village. Regency Park. Reflecting on the positive impact the sustainability program has made, how assistance through the sustainability program enabled them to improve on their screening process. The DOC also states that they felt 100% more supported since the partnership was implemented. Heron Terrace. As you know, many COVID positive residents were sent to the field hospital. This responsiveness to their needs was truly appreciated. The community support and a collaborative approach to healthcare truly makes a difference, states Amy of Heron Terrace.
Pretty great presentation. Karen, we'll try and get you get your comments real quick, and then we'll pass it on to Marie and Erica as well for additional comments.
I think I'm officially unmuted.
Yes.
If I couldn't be the opener, I'd like to be the closer. And David's exactly right. The work of this team is unbelievable. We look at recommendations that came out of Ontario Health in October. And it's, I think, a credit to the hospital and our community that the recommendations that came out in October are ones that we implemented in March and April. A regional approach, a team approach, partnership, develop relationships. All of these things were done on the ground at the time that a crisis was actually on our doorstep. And it's an absolute tribute to Marie and to Erica and to Karen Riddell and to David, who's going to be too modest to say that he was also in homes doing swabbing. It was a total sector reaction and a relationship to doing everything that needs to be done. And this is one example of how this organization has stepped forward and what has been done for the community. So thank you.
Thanks, Karen. Erica or Marie, do you have any comments?
Yeah, I think, it's been a wonderful partnership. The leadership at the rest homes and long-term care have been absolutely receptive and engaged in this partnership.
That's great.
And I have to say that I did enjoy visiting the homes and getting to meet new people and finding out, some of the struggles that we have in hospital. They have the same struggles or issues there. So it was nice to be able to connect with them and to offer our support.
Perfect. From the board, does anybody have any questions or comments? Sorry, I'm just taking a look. Sorry.
Cynthia?
No. Oh, I do not see. Sorry, my screen is freezing, so I do apologize. I can't see everybody here. I will.
Okay, you called upon me, David. Thank you. I just want to say that this just shows the response of Windsor Regional Hospital working with the community when a crisis with the pandemic erupted, and how we and the community as partnerships came together to assist and and to embrace the situation we were under and to get that done. So for Windsor Regional Hospital, everyone on the team that made that possible, for the community that was involved, that is what helped save our community for where it was going.
Thanks, Cynthia. I guess from my point of view, it's all about the team, and we have the best team around. And from top to bottom, I'm very, very proud of every single one of the employees at Windsor Regional Hospital for the job that they've done during this pandemic, and the outreach and the work that the teams have done with the long-term care homes and the retirement facilities is remarkable. And I think in the province, I think other regions look at us and they're wowed by the work that the team has accomplished. So on behalf of the board, I want to say thank you to all of you. It's so much appreciated. I know it's a lot of long hours and hard work and dedication. So thank you to all of you. Again, it's pretty amazing what you guys do. And again, it's the team, and all of our partners locally. I want to thank them too. So appreciate it. So we will move on to, so if there's no other questions or comments, we will.
Oh, Mr. Chair, if I could just comment.
Oh, yeah, absolutely, David.
Okay, before this becomes viral, I was not involved in the direct swabbing of any. I did visit with the team to, I think, 20 out of the 21 homes. I did fill out the labels on the tubes where you put the swab in. So I was involved in that, but I never stuck a swab up anyone's nose, not even my own. But I agree with you, just so that doesn't take off. But I agree with you, Mr. Chair, is Marie, Erica, there's a team, have done an amazing job. Ontario Health, EMS, public health's involved, and they had the list, and I'm going to forget. And clearly the long-term care and retirement homes, it has, when this all broke, it was tragic, and our team, along with everyone else, including the other hospitals, rallied around and said, we got to help as best we can. And not only did that happen, but also we learned a lot from the long-term care and retirement home sector. As Erica outlined, they go through the same struggles we go through. So, you know, we had Zoom calls with their staff, because a lot of them, by that time, we already had positive COVID cases in the hospital, and a lot of them still didn't have any. And we had said our most nervous time was before we had any COVID positive cases. We were on eggshells at the hospital, because you're kind of, what if, what about this, what about that? So we shared that with them to say, hey, we're no different. We had a lot of anxiety, and we were there to help them answer some of their questions and concerns, and hopefully reduce some of their anxiety. So definitely moving forward is this is a relationship that is not, in my opinion, should not stop once COVID quote is resolved, if it's ever resolved, but let's assume it is resolved. This relationship should not stop, because it's beneficial for all the parties involved to continue this relationship moving forward between hospitals and long-term care and retirement homes. And I'll close it on a selfish part. Is one of the reasons I did attend the long-term care and retirement homes is to find my eventual future home. And I think I have. There's an amazing list of homes out there. If anyone wants to, I can share my ideas with you. But that's definitely, and I know Karen Riddell's on this call too. One of the criticisms we had with Karen McCullough, because Karen McCullough would book the appointments with the long-term care retirement homes for our team to go. One of the major criticisms I had is the fact that we always seem to be there the day before happy hour. And I can tell you, in these long-term care retirement homes, I'm looking forward to their happy hour. And they have some fantastic ones with beautiful drinks, and even charcuterie, and some of them pre-COVID stuff, but COVID charcuterie boards don't work that well, but they will eventually. But when it comes to wine and some alcohol, I'm telling you, these places got to figure it out. So I'm looking forward to eventually going into them, and we'll work out our scheduling issue as we move forward. But for some reason, we always missed happy hour. But other than that, the team did great. So thanks.
All right. Great. So I will move on to the regular portion of our meeting. Do we have any declarations of conflict of interest? I see none. Wonderful. Thank you. Can I get a motion to approve the previous minutes? I'm seeing Dan and Paul. All right. Thanks, Dan and Paul. Any questions or comments with regards to the previous minutes? Seeing none, all in favor? All right, wonderful. Thank you so much. Next up, we'll have the report of the President and CEO, David Mouche.
Thank you, Mr. Chair. So you have my report. What I did in the report is we just implemented or announced at the last board meeting our new strategic plan. We're just putting the final touches on the communication documents, which you'll start seeing in the month of November and in December. And it's our new strategic plan for the years 2021 to 2024. And as normal, what I tried to do was break down my report on the basis of our new strategic directions and initiatives and try to highlight what we're working on. And the first one regarding strengthening patient safety and quality, I do focus on long-term care. And I do put into the report the issue that we're seeing across the province is, unfortunately, we're starting to see an increase in the number of positive cases that are occurring within the long-term care sector. Locally, because of the work of the greater team, including our Windsor Regional Hospital team, although we have had some outbreaks, in large part, all the work that the long-term care retirement homes and our hospital teams, Ontario Health, have done have really been very proactive. And when an outbreak does occur, we are immediately reactive. The homes are immediately reactive. We know what to do. We work together, try to cohort the residents and also the staff impacted. And at the same time, what we have found, which is verified by multiple studies I can go through, is the concept of going in, swabbing all of the residents, swabbing all of the staff, recalibrating, getting the results back, seeing who is positive, segregating them, going through, making sure all the IPAC issues are taken care of, re-swab again, and keep doing that till basically you get nothing but negatives. Once you get nothing but negatives, then generally you're okay. And we have seen great success with that approach. We had one home recently that had, I think it was 2 staff and at least 2 residents that were positive. We treated, because it was a smaller home, we treated it as basically one unit, meaning we did that swab everybody approach. We were able to segregate individuals. We had minimal hospitalizations. They were, in large part, a lot of them had to do with social hospitalization, meaning there were just some issues not directly related to COVID, but we took care of the patients in the hospital. We had no critical care admissions from the home. And of course, the most important thing is no deaths from the home. And we have some recent homes in outbreak, and we're following the same pattern with the home under our control and our involvement. And hopefully it goes well. And we're working very closely with the home, and they're working their tail off. So I'm not saying we're anywhere near through the woods on this, but it does work, and we stand a chance when we follow that approach. And again, there are multiple research studies out now from across the world that indicate that is the approach to follow. And it is one we started ourselves articulating, as you recall, back in March when all this started. Next thing I highlight is the flu update. Great thing about so far with respect to the flu, even though there is some provincial stories and we have our own issues with respect to the number of vaccines that are available, isn't exactly where we want it to be, but there's supposed to be a bigger shipment coming in the middle of November, so hopefully that'll increase. In my report, I have, because my report's basically written a week ago, there's been a new Canadian report with respect to influenza, and they have had an increase in the number of testings. So they have increased the number of people they've tested, and they've tested in what they call it week 43, is they've done over close to 8,000 tests for influenza, were performed across Canada, which is 2 times the average for this week over the past 6 years. So it's double the amount of tests. The percentage of positive is 0.02% compared to 2.8% during the past 2 seasons. So that is very dramatic in the sense that the fact, number one, hopefully everyone is getting a vaccine, and I know there's a big demand for it. Everyone's doing their best to get a vaccine. But number two, the public health measures we've taken as a province, nation, clearly Essex County, has helped so far. It's early, it's November 5th. So far has helped in keeping influenza at bay. And clearly, as we know, the last thing we want to be doing is fighting COVID and fighting influenza at the same time. There's a word for that. I forget what it's called. Someone will text it to me. And so far it's working that we've kept influenza, quote, at bay, and we have to continue to do that. The week before in my report, I indicated they had 1 laboratory detection of influenza, and it was a false positive. And on average, they have close to 500 positive influenza detections during this period of time. And as I stated, to date, they've only had 5 instead of 500. So that's dramatic. In my report also, we talked about this at the last board meeting, is the provincial budget. We were not anticipating any discussion whatsoever of the capital plan in this budget. We had some high-level discussions with political individuals with the Conservative government who indicated it'll be in March. So that's what we'll look. We have a lot of work to do between now and March to ensure that moving forward with stage 2 happens officially with respect to the grant, et cetera. And the mayor has, stated he met with the Minister of Labor last week. And also I can tell you there's been other meetings I've been involved with that have been very positive. And we continue to work with the bureaucratic side, the capital side on the project as well, and moving the project forward. However, the budget was announced and we have to weed through it exactly what it says. There is nothing, the devil's in the details in the sense of there's substantial amount of funding that has happened with respect to the province with respect to COVID expenses. So if you recall at the last board meeting, we had talked about the fact that we were waiting on our March and April payments for COVID expenses. The government has agreed that we can announce that we did receive our March and April COVID expenses. And also they just provided us a letter, all hospitals a letter, that May, June, and July, is it, Mark? They didn't say August, right? No. So May, June, and July, we should get our COVID expenses reimbursed within the next couple weeks. I think it was mid-November they were going to process it, they said, as well as any capital expenses we had with respect to COVID, because there's a capital part and there's the operational part, and we've submitted both because we had to do some capital work, especially with respect to St. Clair and elsewhere, that we had to put in as capital, and they're reimbursing both those streams. So they are fulfilling exactly what they promised. They promised, do the work, submit the expenses, we'll reimburse you for the expenses. And that's the approach we have taken. And I know the media spent a considerable amount of time at the last meeting saying, are you sure? Are you sure they're going to do it? Are you sure they're going to do it? We said, yes, they're going to do it. They promised they're going to do it. They're going to do it. They have to do it. And they did. So that is good news, because that helps, of course, with cash flow for the organization. And Mark will, and the chair of finance, our treasurer, will outline that in the report on the impact that has. And the final thing in my report that I want to highlight is with respect to The issue about We Spark and Hotel Do, there is a survey for healthcare workers to complete to participate. That's open until it's available now, October 26th till the end of November. And it just talks about the emotional well-being of healthcare workers and doing a research study on that and trying then to continue with the supports that are there both locally and provincially to get through this very stressful time. And We Spark is Windsor Essex Spark Health Institute. It's made up of ourselves, Hotel Dieu Grace Healthcare, the University of Windsor, and St. Clair College. It's a local research group that has been spearheaded by the university primarily and involves all the partners on doing various research projects, health related. So very positive initiative that is underway, and that's just one of the research studies they're dealing with. So, Mr. Chair, that's my report. If there are any questions.
Questions for David? And seeing none, hearing none. All right, David, thank you so much. And again, great work, team. Great work by Spark as well. It's a great initiative being spearheaded by the university. A lot of great things to come. I know Dr. Saad is excited by some of the stuff they're doing as well. Next up, the Schulich report is in everybody's packet, or actually there is no report in your package. We'll get an update next month. Unfortunately, Dr. Jacobs could not be with us tonight. Next on our agenda is the financial presentation, the treasurer's report.
Just checking, you see the screen?
I can't,
Yes, we can see the screen.
Okay,
No, Penny, you put yourself on mute.
mute. Okay. I did not put myself on mute, but, okay, can you hear me now?
yes.
Good.
Yep.
Good, thank you. All righty. Okay, this is, of course, is the financial results, the hospital operations, September 30th. And as you can see, the actual surplus, which is not a surplus, it's a deficit, is about 2,593,000. There was some other information about COVID-related unfunded extraordinary operating expenses included above. And then there's unrelated, there's also revenue that's been lost, like for instance, from parking charges and cafeterias and those kind of things. So that's that one. Is guess we can get to the next one. Okay, this is sort of a report on the extraordinary COVID-19 operating expenses, which you can see the operating one is unfunded with 13,302,465. And we'll talk more a little bit about that in another slide or so. And then the revenue is also unfunded in spots, but that's that we'll have to wait and see about. Okay, here we are. The current fiscal reimbursement is about, well, is
is 2.7 million, which is good, to know that for March and April. And then there's also a number of other COVID expenses that will be, we're hoping, we're definitely confident that this ministry is going to continue to support, as David said, the additional costs we were facing, and that is really good too. And so that is, that's really good. Now the next one is the current net surplus is 3,689,000. It's different than the 2,593 because the net surplus includes the depreciation of the buildings, so it's a little bit different. The normal current one is for the operations is 2,593,000, and but good news is if we get the reimbursements we're hoping to get, which I think we are going to get for sure, is we would have a revised surplus, not a deficit. The brackets up there, that's the deficit, would be around 3.3 million there, 3 million. So that is, hopefully that is really good news. And we're going to get those costs taken care of, which is good. And there's just the information on that. And one of the things that is a little iffy is the 3.3 million for the quality-based procedures because of the cancellation of elective surgeries. And we'll have to see how that works out. And I guess you can just read the rest and the expenses. The salary and wages, well, they've had they had the pandemic pay, but they also got reimbursed we have been reimbursed on the revenue side for the pandemic pay as well. So, and then isolation pay. So there's a lot of change with the salary and wages. And that's just, if you look at, So sick and isolation pay is, but it's starting to drop from the, greatly drop from April to September, which is good news, not just financially, but it means that people aren't getting sick. So, so that's that one. And then we have the drugs that are unfavorable, but drug expenses are under budget. And so anyhow, other supplies, we do have minor equipment purchases, the 2,053,000 to COVID-19, but that would be in the listing that the board sent to the ministry for reimbursement. So, and then utilities costs are good. So that's good because they have a rebate right now. And it was supposed to expire this Halloween. It's now been revised and extended to April 2021, which is great news actually. So that's good. And then we have the patient access. Not too much change in the target and the actual for most of them, both campuses. So that's not too bad. That's good. Patient volume, there's still, it's when you have the total, the September actual versus the September 2020, but 2019, there is a drop in all the categories, but that was a very significant drop, like in the early times of COVID, like March and April, and maybe even in May. That's built into that because this is from the beginning of the fiscal year to September. Patient days, they're below plan, but actually it's sort of not fairly even actually. So and closer to normalized patient days, it should be now. And then the organization health, well, this again, this is not just for September, this is for all the months up to September. So yes, there is some extra sick time and not much overtime, but on MET. And then for both OLAT sick time and overtime, they have more than the target. But again, it's not just September, it's the whole year, and that includes all the early COVID issues. Is there any other questions or?
Do we have any questions or comments for Penny or Mark? There is a lot of information in there, and it is exciting news that the province is going to be funding us a lot of our expenses. So again, exciting news. Yes, it is. I think it's really good news. And then I'll just, that's just, can I go to the next one, the consent agenda? You can.
Okay. Yes, which is basically the minutes. So what I'm going to do is I'm going to say, I'll move that the report from, there's a motion that the report from October 26, 2020, Finance Audit and Resources Committee's meeting be accepted.
All right, so Penny made that motion. Can I get somebody to second that? Arvind, thank you, Arvind. Do we have any questions or comments with regards to that, the consent agenda? Seeing none, all in favor? All right, opposed? Great, thank you. Excuse me. We have the correspondence printed matter as an FYI. That's a media report only. Do we have any no board member questions or comment? Any additional questions, comments, concerns from the board members? Seeing none, wonderful, thank you. The date of our next meeting is Thursday, December the 10th. So just everybody, FYI, because of December's it's a strange month. A lot of time off. We instead of having our meeting on the first Thursday of the month, we have it on the second. So just so everybody, that is a friendly reminder for all our YouTube viewers out there. Thanks, Mom. Appreciate it. So again, date of our next meeting. Can I get a motion to adjourn? We have Penny and Pam is seconding that. All in favor? That is unanimous. Thanks so much, everybody. And that is the end of our meeting. We will see the board in a few minutes in our next session. So
Marie and
yeah, thanks, Marie.
log into the scrum.